Marfan syndrome is a disease that is caused by a mutation in the FBN1 gene, and it affects connective tissue in various parts of the body. This mutation usually causes the limbs of the affected individual to grow abnormally long, similar to what is seen in this picture.
The disease, Marfan syndrome, which affects the body's connective tissue, mainly causing problems with the lungs, spine, and eyes, can lead to potentially deadly heart complications. When looking at a person with Marfan syndrome, some of the symptoms that one can see from this genetic disorder include having unusually long arms, legs, or fingers. Although not always, most people with the genetic disorder show to have a lower body mass index, making the appearance of the long appendages more noticeable. Around 6 in every 10 people with Marfan syndrome also develop scoliosis, causing significant curvature of the spine. Marfan syndrome can sometimes affect the natural position of the chest. In rare cases, a person's chest can be severely concave and press up against their lungs, causing breathing problems. Other noticeable symptoms that may be present in a person with Marfan syndrome include flat feet and crowded teeth. Some symptoms of Marfan syndrome that one may not initially notice include certain heart problems, as alluded to from before, and eye or retina problems, affecting the vision of the person with the genetic disorder. Some of the most popular symptoms include an increased chance of back pain, as the spine can be abnormally curved to the sides. In addition to some of the heart problems I mentioned previously, there's also an increased risk of heart murmurs where blood flows more rapidly than normal. People with Marfan syndrome will typically have more checkups with the cardiologist performing either an EKG or echocardiogram to monitor the possible heart murmurs. Other possible symptoms include long appendages and eye problems, as people with Marfan syndrome show to have blurry vision or extreme nearsightedness. This can be caused by the lens in one's eye to be moved out of place.
The inheritance pattern for Marfan's is autosomal dominant, which means that just a single copy of a mutated gene is enough to cause the disease. 1 in 5,000 people are affected, and of the people affected, 75% inherit the gene from the parents and 25% are spontaneous mutants. There's a 50% chance that the spontaneous mutants pass the gene on to their progeny.
Next, we will discuss the prevalence of Marfan syndrome. In the US, it is estimated that 0.02% of the population has Marfan syndrome. Going based off of current population numbers, there are around 66,000 people with Marfan syndrome in the US. In order for a disorder to be labeled as rare, under 200,000 people have to be affected. This is why Marfan syndrome is labeled as a rare disorder. If we were to apply this 0.02% to the population of 6 continents, this is how many people would be affected by Marfan syndrome worldwide. It was hard to find specific data on the prevalence of Marfan syndrome over the years in the US, so here's a graph that we made showing the fraction of the total population who had Marfan syndrome in Denmark from 1977 to 2014.
Now we will be talking about the current treatments of Marfan syndrome. Before I start with current treatments, it is important to note that in recent years, scientists have been working on ways to correct the FBN1 mutation that causes Marfan syndrome using base editing. While they have been successful, they are still testing it to make sure that this is a near perfect way to cure Marfan syndrome both in embryos and people. Because base editing for the FBN1 mutation is still in testing, there is currently no cure for Marfan syndrome once you have it, but there are ways to help the symptoms. One way is through blood pressure medication to help with the strain on the aorta. This can include beta blockers and calcium channel blockers. Marfan syndrome can also cause scoliosis, and chest braces might be necessary to combat it. If the symptoms of Marfan syndrome are severe enough, surgery might be a necessary treatment. In the cardiovascular system, the aorta or heart valves, such as the mitral valve, may need to be repaired or even replaced. And in the skeletal system, if the scoliosis is severe enough, it may need surgery to repair it. Finally, there are certain things that a person with Marfan syndrome could avoid in order to lessen their symptoms. These things include physical activities such as contact sports or weightlifting, restrictive activity that restrict breathing, such as playing a brass instrument or scuba diving, participating in illegal drugs such as heroin or cocaine, or taking medications that specifically narrow blood vessels or increase blood pressure. All of these things can cause a strain on the heart, which can make symptoms much more severe.
In conclusion, there are ethical and economic impacts of Marfans. For the ethical impacts, in some sports like basketball, individuals who are too tall are required to undergo genetic testing. For the economic impacts, a study done in Germany in 2008 revealed that those with Marfans spent an additional €2,496 on care. The highest cost drivers were inpatient treatment and non-physician care. Those with Marfans had 39% more physician contacts, 153% longer average length of hospital stay, 119% more inpatient stays, 33% more prescriptions, 236% more medical imaging, and 20% higher average prescription costs than the control individuals.